Gateways Hospital and Mental Health Centers is dedicated to addressing the urgent mental health care needs across Southern California. As a safety net hospital, we offer specialized services to all patients, regardless of their ability to pay. In partnership with the University of California system, Gateways is training nurse practitioners as psychiatric mental health nurse practitioners. With decades of experience in caring for vulnerable youth exposed to trauma, Gateways prioritizes compassionate, whole-person care to help improve trauma-exposed individuals' mental well-being. Traumatic experiences, especially those faced during childhood, reverberate through a person's life, potentially leading to severe physical, social, and mental health issues. Because trauma significantly impacts an individual's overall well-being, it is critical to identify any severe experiences to create an informed, effective treatment plan. Gateways partnered with UCLA to evaluate trauma-informed care and adverse childhood experiences, ACEs, screenings in inpatient settings.
Trauma can arise from events like accidents, abuse, neglect, and violence. And we know that when trauma happens in childhood, which we call adverse childhood experiences or ACEs, these types of trauma are especially harmful to children's health and lives. Recognizing ACEs allows providers to tailor treatment to each patient's needs. Despite growing awareness about ACEs and their harms, many mental health centers lack resources to address them holistically and according to evidence. From research at UCLA and other research institutions, we know that up to 1 in 5 Californians experience 4 or more ACEs before age 18, which increases their risk for depression, stroke, cancer, heart disease, and other types of mental illness. Gateways is dedicated to expanding trauma-informed care and ACE screening to better support adolescents and transition-age youth in achieving mental wellness.
Gateways and UCLA have collaborated for the last 4 years, expanding research and resources to support the most vulnerable populations. Our research, supported by a $75,000 grant from the Hearst Foundation, evaluated trauma-informed care implementation and ACE screenings in our adolescent inpatient unit. The study revealed that 94% of adolescents screened had at least one ACE, and 56% had 4 or more ACEs, indicating a high need for trauma-informed services and meeting the clinical threshold for high risk and toxic stress requiring intervention. Targeting ACEs with trauma-informed care is one effective strategy to improve youth mental health. Because Gateways offers an inpatient crisis program and a community-based outpatient treatment program, it is uniquely positioned to ensure a continuum of care for trauma-exposed youth.
While trauma is common, only a quarter of those exposed develop PTSD or severe responses. Unfortunately, few receive necessary screenings and proper care. Oftentimes, physical and mental health are seen as separate issues, which may put an individual who's experienced trauma in a triggering environment. Gateways integrates physical and mental health to cultivate more effective pathways to sustained well-being for their patients. Trauma-informed care is a service model in which healthcare practitioners consider trauma to evaluate a patient and provide them with the best path forward to their overall wellness. This model restores power to patients by expanding their treatment options and decision-making opportunities. Gateway's expansion of trauma-informed care will train the new generation of mental health professionals and PMHNPs through this unique approach. UCLA and Gateways are looking to expand trauma-focused cognitive behavioral therapy, otherwise known as TFCBT, a specific type of evidence-based treatment for PTSD, the leading evidence-based treatment modality for trauma among children. This treatment has very few providers, and this grant will increase the number of available practitioners, expanding access to the care that clients throughout Southern California need.
Senator Padilla secured $500,000 in the fiscal year 2024 appropriations package to expand our capacity for trauma-informed care and ACE screenings. Within this funding, Gateways plans to reach an additional 250 youth within a year, extend screenings to adolescents and transition-age youth, and expand telehealth services. We will train up to 10 clinicians in TFCBT through the National Therapist Certification Program, enhancing our response to high ACEs screens and trauma assessments. The partnership with UCLA will provide nursing students with clinical training experience at Gateways, bridging the gap between mental and physical health. This funding and our partnership with UCLA will deepen our work with communities in need, creating meaningful pathways to recovery.
In addition to expanding trauma-informed care capacity and training, it is crucial to create a program tailored to those who need it most. A key component will be Gateway's newly established Family Advisory Board, which will help ensure patient-centered service development. Composed of 10 to 20 former patient and parents selected by Gateways, this board will meet regularly to offer advice on programs and planning. This approach aligns with Gateway's person-centered philosophy, emphasizing the critical role of family involvement in supporting recovery at every stage.
Gateway's success is deeply rooted in community partnerships, which have been instrumental in improving long-term outcomes and the sustainability of our programs. By standing with Gateways, you play a vital role in helping us advance crucial research, maintain staff training, and sustain our commitment to offering high-quality care. Together, we can work towards a future where everyone has access to the best mental health care, fostering a healthier, more compassionate community for all.